You may be familiar with the saying, "I've got your six." It's a saying that was attributed to World War I squadron pilots. When using a clock to describe positioning in space, the number 6 is behind you. So when someone says they got your 6, they're basically saying they've got your back. Today, I'm going to introduce a new saying from the recovery room, and it is protect your 6. Now, I'm not talking about the spatial 6 behind you. I'm talking about the 6 feet around you. I'm cancer physical therapy specialist, Dr. Leslie Walke, and today in the recovery room and in the upcoming videos, we are talking about the current coronavirus pandemic affecting you as a person with cancer or a history of cancer, and how best to protect your 6. So here we're talking about you being a person with cancer or a history of cancer and how that impacts you when it comes to living in the middle of this pandemic. Along with conditions such as hypertension, diabetes, cardiovascular disease, chronic lung disease, and obesity, cancer is listed as one of the leading factors to the likelihood of getting seriously ill if you were to contract the coronavirus. This coronavirus is called a novel coronavirus because it is new. It made itself known in late 2019. Its official name is SARS-CoV-2, and the disease it causes is COVID-19. The 19 comes from 2019. Because this specific coronavirus is relatively new, we are still learning and collecting more and more data. Yet here's what we know so far when it comes to cancer. As of September 2020, the largest study to date was published in the European Journal of Cancer. They looked at 52 studies involving almost 19,000 people with cancer that got COVID-19. And the numbers are not good. People with cancer that got COVID-19 had a much higher death rate compared to people without cancer that got COVID-19. The death rates in the individual studies varied anywhere from 16% to 35%. Those are super scary numbers. These numbers led the authors of the study to conclude aggressive measures must be taken to reduce the risk of coronavirus infection in patients with cancer. Okay, so what does this mean for you? First, I want you to talk with your medical oncologist about you, your type of cancer, and your specific treatment so you can better understand your specific risk. But in general, if you currently have cancer, you need to aggressively protect yourself. If you are currently receiving chemotherapy, biological therapy, or immunotherapy drugs, again, talk with your medical oncologist. Some of these drugs impact your immune system just a little. Some of them impact your immune system a lot, and some not at all. This is information you need to know. If you are currently receiving radiation, talk with your radiation oncologist about its impact on your immune system. Most often, radiation does not impact immunity. If, however, you are getting radiation to your bones or spine, it may impact your immune function because, remember, the bone marrow is a huge producer of blood cells. So again, talk with your radiation oncologist to learn your specific risk. If you are a months or years-long survivor of leukemia, lymphoma, or multiple myeloma, you may have long-term impact on your immune system. Know your risk. Discuss this with your medical oncologist. If you have or have had lung cancer or have lung metastasis, studies suggest getting COVID-19 could be especially dangerous for you. COVID-19 attacks the lungs. The impact of lung cancer and lung cancer treatment on your long-term lung function can vary from very minimal to very significant. Talk with your cancer team about your current lung function and your risk profile. Now, if you are a cancer survivor of other types of cancer, like breast, prostate, colorectal, the impact of treatment on your immune system long-term is typically minimal to none. Most often, immune function returns to base level within several months after conclusion of the chemotherapy. So if you are months or years out of treatment for a cancer other than leukemia, lymphoma, myeloma, or lung cancer, your risk of getting seriously ill if you were to catch the coronavirus is most likely equal to that of the general population. Again, if you have questions, don't go to Dr. Google. Go to your doctor to get the best info and answer for you. When it comes to the coronavirus pandemic, we will talk more about how to best protect yourself, the use of masks, creating your action plan, staying mentally and physically fit and strong, and more. But for now, I'm Cancer PT Dr. Leslie Walke, signing out from the recovery room. Until we talk again, protect your 6. And yes, I've got your 6. We'll talk again soon.